Dr. Abdolki went to medical school in Damascus, Syria. This is also a city in which she was born and raised. She's the eldest of 4 children. She had her internship and residency at Our Lady of Mercy Medical Center in the Bronx. She also had a fellowship at the New York Medical College. Dr. Abdolki came to Syracuse 28 years ago. Way too young for that. After a few years here, she moved to New York City for a while and then practiced medicine for 5 years in Oconto, Wisconsin. After Wisconsin practice, Dr. Abdolki and Dr. Bashara came back to Syracuse. In terms of research experience, Dr. Abdolki was principal investigator for pharmaceutical clinical trials as well as a sub-investigator on many. She met her husband, cardiologist Dr. Mazen Bashara, while in medical school in Damascus and married after graduation. She and Dr. Bashara are the proud parents of daughter Maya, who is currently employed at corporate headquarters of Toys R Us, and Michael, who is attending Colgate University as a psychology major. Her personal pursuits include ballroom dancing, oil painting, and cooking. Ladies and gentlemen, please join me in welcoming President Mary Abdolki.
Thank you for the introduction, Dr. Beers. It has been always an honor and privilege working with you. I look forward to supporting your vision now and in the future as you continue to be a beacon for our society. Good evening, colleagues, friends, and family. I would like to extend special thanks for each and every one of you for your presence here today, for supporting our society. I would like to extend special thank you to the Executive Council members for deeming me worthy of the elected office of President, and to Dr. Ramzi Farah for introducing me to the Council and encouraging me to serve. I am so grateful for my husband, my friend, and forever companion, Mazen Bashara, who has been with me every step of the way, and for my children, Maya and Michael, for enriching our lives with endless happiness and pride. Thank you to my associates and staff at Arthritis Health Associates and my senior partner, Dr. Patrick Riccardi, for the support you provide, allowing me the opportunity to devote necessary time to serve the society. I am grateful to our community and friends for your encouragement and continuing support, evidenced by your presence here today. Finally, special thank you to my uncles David and Farid Abdolki and their families for encouraging us to immigrate to the United States and helping us with our first steps in this country. The eldest of 4 children, I was born in Damascus, Syria in the mid-1960s. My father, George, left before dawn each day in order to provide for his family. Georgette, my mother, worked tirelessly to make our house a loving home. As is customary amongst Middle Eastern families, as the firstborn child, I was raised with the ideals of my parents representing their hopes and dreams to serve as a role model for my younger siblings. I was taught the importance of education, perseverance to achieve noble goals, and impeccable work ethics. I was in middle school when I had my first encounter with the human biology and became immediately fascinated by the intricate logic of physiology. I was intrigued and began successfully to follow the path of general scientific studies. It was with the unwavering support and love of my parents and siblings that I was able to realize my dreams. While they regret they are not able to be here today due to circumstances beyond their control, they are with us in spirit. To my family in Damascus, my undying love and gratitude. As two young physicians, my husband and I came to Syracuse eagerly anticipating the start of our new lives and medical careers. Syracuse welcomed and embraced us, giving us what we needed to succeed and enabling us to provide our own family with a happy and loving home. It has been a great honor serving in the medical society of the city that first welcomed us 28 years ago. I am grateful and amazed to be standing before you today, having been afforded this opportunity to serve and give something in return. Ladies and gentlemen, the exponential increase in healthcare costs, coupled with the public's demand to universally insure all Americans, has in recent years accelerated changes in healthcare regulations, insurance reimbursement, and patient coverage. In an effort to meet the demands of society, on January 1st, 2017, Medicare will begin linking reimbursement for care to patient outcomes and costs. These pending changes have created a new vocabulary of terminology foreign to the ears of physicians. We are confronted with a plethora of acronyms like MACRA, MIPS, ATMs. Fear of unknown has created tension and apprehension for hospitals, physicians, and medical community as a whole. It is, however, through understanding and knowledge that we will not only survive, but thrive. As regulators work to define the new system and experts work to interpret it, it begs the question, what now is the proper way, is the proper course of action for physicians? The Chinese philosopher Confucius said, quote, "Life is really simple, but we insist in making it complicated," end quote. These changes do not have to be complicated. To simplify them, we must understand that American society is asking that the medical community maintain their expectations of high-quality, low-cost health care. Translation, we as physicians must provide the best care to all patients at the least possible expense. How can we, as a medical community, achieve this goal? The resources we have at our disposal to maintain our standard of medical ethics while managing these difficult tasks are rooted in scientific evidence and innovative approaches. The focus upon prevention, population health approach, and the creation of a cooperative culture between large healthcare organizations while channeling effort through governmental agencies are just some of the methods we can utilize. Another wise man, Benjamin Franklin, said, quote, "An ounce of prevention is worth a pound of cure," end quote. I truly believe that a preventative approach to medicine is a preferred way of guaranteeing the health outcome for patients at a lower cost than advanced treatment and hospitalization. Achieving this shift in culture, however, will require a systematic approach on a large scale, including the effective dissemination of information to physicians and the public alike. By adopting better preventative measures, each one of us is empowered to improve the general well-being of our society and lower the economic costs of the healthcare system for us and our patients. Emphasizing lifestyle changes such as physical activity and healthy eating habits, for example, are a cost-effective approach for extending survival and reducing the need for specialized healthcare. Ensuring timely vaccinations will reduce the epidemics and the need for hospitalization. Compliance with appropriate cancer screenings will not only reduce the prevalence and advancement of the disease, but will save lives. Population health approach to societal epidemics, such as addiction to illicit drugs and prescription medication and obesity, is a must to a healthier and wealthier American society. Despite the simplicity of the concept, the work necessary is extensive. It requires the involvement of everyone. The Onondaga County Medical Society, as a representative of our local community, should assume leadership in this matter, assisting our physicians in making prevention the priority of their care, helping to distribute information about access to the public, and continuing to work with the health commissioner and governmental officials in combating societal epidemics. Our role in reducing healthcare costs will include working to get the large organizations in our community to operate in congruity, providing more complementary and less competitive services to our community. We must encourage them to focus their resources upon population health, proper post-discharge follow-up, and reducing readmissions. I pledge to work with our hospital's leadership on ways for the society to help them realize these goals. Ladies and gentlemen, our medical society can and should play a leading role in affecting these changes. Our medical society, however, is only as powerful as the involvement and commitment of each individual member. Without a doubt, our society needs and deserves the concerted effort of all physicians in our community. Increasing membership in the medical society is a must, and encouraging the continued participation of our current members is paramount to our success. The medical society's contribution to those issues encountered by our physicians are intrinsic to solving everyday practice challenges. Our society continues to provide our physician community with a unified voice. Through advocacy and regularly scheduled meetings with our state and local representatives, we are able to present the fervent issues related to physicians' daily needs, ranging from malpractice costs to insurance reimbursement and regulatory burdens. I will continue to work ardently with our society to aid and support our local physicians. In conclusion, over the past 3 decades of my medical practice, I have learned the humbling fact that the more we know as physicians, the more we need to learn. The sea of knowledge that is our profession has an ever-changing tide. During my career, I have been able to acquire knowledge very effectively through communications with my patients and my peers. I intend to continue this method of open communication during my term so that I might best understand your concerns and serve you. To achieve that goal, I ask that each one of you communicate openly with me, as I pledge to do my utmost to resolve the crucial issues related to our medical society. Thank you again for your vote of confidence in me. I will do my best to live up to your expectations.
Thank you, Dr. Abdolki. And as a symbolic gesture indicating a change in leadership, I present this gavel to you. I know you will use it wisely and with respect, and hopefully not on me.
Dr. Beers, I am most pleased to present to you on behalf of our membership this cloth personalized with your name inscribed with your term of office. The Onondaga County Medical Society is indebted to you for your distinguished service this past year.
completes our program.